Good morning. I'm very sorry not to be with you personally today, but I'm very grateful to have the opportunity to share some thoughts with you now at the start of this important meeting on behalf of the HHS Office of Climate Change and Health Equity, and more broadly, the Department of Health and Human Services itself. I want to extend my thanks and also my congratulations to Dr. Kurth and the New York Academy of Medicine for convening today on such an important topic, designing health systems resilience, and the thanks are for inviting me to take part in it. There's no better time than right now to be having this discussion. Around the world, there's great progress being made in mobilizing the health sector towards climate action. 148 nations have signed a declaration committing their national health systems. The World Health Organization is creating a new global plan of work that we hope will integrate climate change across all the bureaus for the first time. And a resolution is being prepared for the next World Health Assembly that will direct countries and the World Health Organization towards more robust actions on decarbonization and resilience. The countries chairing the G7 and G20, Italy and Brazil, have both prioritized climate action for the health sector in their work programs for this year. Now, this is high-level activity and may not directly lead to great change on the ground, but I actually believe it reflects a building movement in many countries. Or in other words, the change on the ground that is now happening around the world is motivating national and international leadership to even more prioritize climate actions in the health sector. Here in the US, we have mutually reinforcing effects. Bold, forward-looking healthcare organizations like Gunderson, Kaiser Permanente, Common Spirit, and many others, as well as NGOs like Healthcare Without Harm, have been working for over a decade to reduce greenhouse gas emissions from healthcare facilities in the US. And they've been joined by many, many others in just the past few years. Reinforcing this, the Biden administration, through its executive orders, through the creation of the Office of Climate Change and Health Equity, which I have the honor of directing, and through support for historic legislation like the Inflation Reduction Act, this administration has not just signaled the transformation of the health sector as part of a broader national effort, it has put funding and technical resources behind it. And the current administration has grounded its climate work in a context of equity and justice through provisions like the Justice 40 initiative that requires 40% of the benefits of identified federal programs to go to disadvantaged communities, or the provisions of the Inflation Reduction Act that provide bonus credits for decarbonization projects that are located in low-income communities. So our Office of Climate Change and Health Equity operates at the hub of these initiatives, facilitating the decarbonization and the enhanced resilience of the health sector, with an emphasis on assisting those healthcare institutions that serve Justice 40 and low-income communities. Right now, we're in the midst of a catalytic program that offers health systems more detailed information on how they can access the financial resources of the Inflation Reduction Act. The program alternates informational webinars featuring our agency partners with breakout sessions for community health centers, rural hospitals, and essential urban hospitals to help tie health system resilience to the resilience of the communities they serve. These webinars are all being recorded, and they're being added to our unique health sector resource hub, which contains additional guidance on the Inflation Reduction Act, our IRA Quick Finder. It contains clinical referral guidance and much, much more. And you can find us on the web if you go to hhs.gov/OCCHE, or just search on that acronym, OCHE. Our office has sat down individually with all the major divisions of the Department of Health and Human Services, and in December, we collectively released our Climate Change and Health Equity Strategy Supplement, which features over 50 actions across every division to advance climate change actions in the health sector. Our goal is to ensure that everyone who works at HHS understands how climate change affects their everyday mission, and to mainstream climate actions in their health and human service programs. Our health sector climate pledge now has 133 organizations signed on, representing about 900 hospitals. We're actively partnering with a Health Resources and Services Agency, or HRSA, as well as the Centers for Medicare and Medicaid Services, CMS, to incorporate climate resilience into the technical assistance programs they offer healthcare organizations. With the initial steps towards decarbonization saving health systems money, especially when supported by the Inflation Reduction Act, there's simply no reason for health systems to drag their feet. As I mentioned earlier, we firmly believe that the resilience and well-being of all of our communities in the face of a changing climate is inseparably tied to the resilience and well-being of our health systems, and that this is especially true in overburdened and underserved communities across the country. And we're making progress on that vision, but we still have a very, very long way to go. The federal government can only do so much to transform a health system in the United States that is largely private. That is why meetings like this one today and people like those of you in this room are so important. Without full mobilization of the health sector, the health impacts of climate change and the health sector's own contribution to causing those impacts will continue to grow. We have more than enough knowledge to get everyone on the path towards sustainability and resilience. And with the Inflation Reduction Act, we even have unprecedented resources to help everyone get a start. What's left is the will to commit. And I really hope a big surge in that will is one of the outcomes of your meeting today. Thank you for your attention, and thank you for all of the work that you are doing together today.